Hello and welcome to The Print. I am Sumi Sukanya Datta, Senior Assistant Editor with The Print. Today's broadcast is special because we are starting a weekly show, Health and You. In this show, we will take up health related topics that are of importance to our viewers and subjects that concern everyone's well being. In today's discussion, we have two prominent specialists joining us to talk about the first ever India specific guidelines for people with hypertension who also have diabetes. To talk about this, we have Dr. Jyotirmay Pal, President-elect of the Association of Physicians of India. For management he'll talk about the management of hypertension in people with diabetes. Dr. Pal is also affiliated with Sagor Datta Medical College of Kolkata. We are also being joined by cardiologist Dr. Gurpreet S. Wanda. Dr. Wanda is with Dayanand Medical College and Hospital in Ludhiana and Hero DMC Heart Institute. Thank you so much, sir, for joining us in this discussion. We will begin with you, Dr. Pal. While we know that India has a massive burden of both hypertension and diabetes, please tell us how big is the challenge of also patients who have both of these conditions, and also let our viewers understand why the need for India-specific guidelines to manage the condition was felt. Also, a little about how exactly was the guideline developed.
Yes, on behalf of Association of Physicians of India and Indian College of Physicians, last year we formulated a committee because hypertension is diabetes is a major burden in India. During the independence, among the mortality, two-thirds was due to infectious disease and one-third was due to the non-communicable disease. The scenario has reversed in 2024, but the two-third death due to the non-communicable disease and one-third due to the communicable disease. This is
Right.
because there is a massive change in the last 80 years in the lifestyle of the Indians, particularly the food habits, their exercise, decreased exercise, there is increased incidence of obesity, lifestyle change, urbanization, industrialization, and so on. So the burden of diabetes and hypertension increase. It is estimated in 2050 probably India will cross the total burden of diabetes even more than will be the number one and cross the China. And at the same time, hypertension of the different study in urban population, almost up to 30% population is suffering from hypertension, and rural up to the around 15%. And there is a one tendency of increased salt intake of the Indian population. So when these two diseases combine in a particular person, there is a more chance of other different comorbidities or the affection of the different organ like heart and kidney. So that is why, on behalf of Indian College of Physicians, we feel that there should be India-specific guidelines. India is now is advanced in science and technology, so India should have own guideline based on our own data rather than our physician will depend on the Western guidelines. So last year, with the chairmanship of Professor G.S. Wonder, we have made a committee of about 10 to 12 eminent nephrologists, cardiologists, diabetologists, physicians, and we have formulated this guideline. And this has been launched this month in Journal of Association of Physicians of India. So we are very hopeful. This guideline based on Indian data will help the physician to prescribe more appropriately, more rationally of a person who is suffering from both hypertension and diabetes, so that effective management of the hypertension in a diabetic patient can reduce the the different organ affection, particularly that can protect the kidney much more. So this guideline, I am very hopeful, which has been made with the chairmanship of Dr. G.S. Wonder, will be a milestone in the medical history of India. Thank you.
Yeah. Dr. Wanda, you have been closely associated with formulation of these guidelines. Could you please tell us what are the key highlights in the guidelines? What should be there in managing such patients, which is normally not practiced as of now?
See, hypertension, as Dr. Jyotirmay Paul just discussed, is the commonest non-communicable diseases amongst all mankind. And 32% of the population has high blood pressure. So virtually 1 in 3 people have high blood pressure. And whenever the blood pressure is more than 140 by 90, 140
Mhm.
systolic and 90 diastolic, we say that the person is having hypertension. At
Right.
the same time, diabetes is the second commonest non-communicable. Dr. Jyoti was just talking about non-communicable disease getting more and more common because our longevity of life is increasing now. And today, an average Indian longevity of life for women is 70 years and for men is 67 years. So, as he said, during at the time of independence, virtually the longevity of life was 44 years only. So, in terms of public health, longevity, India has gained a lot. But the downside of that is that these non communicable diseases have become more common. And there was a big study actually by the ICMR which showed that almost 14 to 15% of population has diabetes. Now they are close cousins because they are lifestyle diseases. These diseases have a genetic, some people have a genetic predilection because of which the risk in the siblings and in the offsprings of people who have diabetes and hypertension are more. But even mechanistically, they are related to each other. And the second major factor is that hypertension affects the brain, the heart, the eyes, and the peripheral arteries and the kidney. Diabetes also affects primarily the kidneys, the heart, the brain. So the end organs which are affected by both the diseases are the same. And today, actually, the commonest cause of heart attack in our country is diabetes only. The other major risk factors are, of course, high blood pressure and smoking, positive family history. So these two factors are not only very common, but they are also interlinked with each other. And then they tend to occur in the same people more often, because of which we need to be actually, we have to bring the physicians across the country. Actually they should know which are the drugs which are more important for our people, what lifestyles are more important, because Indians consume one of the largest amount of salt in the world. In fact, an average Indian diet today contains about 8 to 10 grams of salt, whereas the guidelines that we have brought out, they suggest not more than 4 gram of salt should be there. Other important factor is weight reduction. If you are able to reduce body weight, you are able to reach the ideal body weight. The blood pressure comes down, diabetes control improves, and now people are even talking of something we never talked of earlier, actually reversing diabetes. You can delay the onset of diabetes by 5 to 7 years by healthy lifestyle. Third
Right.
important factor in lifestyle is smoking. Smoking
Mm-hmm.
is injurious to people who have diabetes and hypertension, and the general public needs to be made aware. Not only cigarette smoking, but also tobacco chewing, which is very common in central part of India. That is equally injurious like cigarette smoking is. Then
Right.
diet, which is actually low in salt, low in fats, high in fruits and vegetables. So all these things have been incorporated in this diet. What diet is healthy for Indian people? What is the ideal weight? The other important thing we have touched upon is the genetic predilection of Indians towards heart attack. Now, Indians who have migrated to other parts of the world, we know that they get heart attacks 10 years earlier than the natives, whether you talk of Singapore, US, UK, Canada, wherever Indians have migrated. The natives of those people actually have heart attacks 10 years later. So we have a thrifty gene which actually we have a predilection for a central obesity. We tend to collect more fat in the central part of our body, which causes this insulin resistance syndrome. And in medical terms, we also call it as syndrome X. So people who are centrally obese, they also have insulin resistance and they have more diabetes and hypertension. So we wanted to bring public awareness, and also we wanted to share with our physicians that they need to be more aggressive in changing the lifestyle of people. And not only this, they need to be more aggressive in controlling the blood sugar levels, controlling the blood pressure levels, treating their lipids, because between these three risk factors, they are the major causes of heart attacks actually.
Yeah. Dr. Paul, can you talk about, the therapies, specifically the types of drugs which have been advised for people with both hypertension and diabetes?
So definitely there are so many drugs in the market that can control the hypertension. But some of the drug has a property to protect the kidney from the effect of the diabetes and both hypertension. So we have advocated some of the drugs which has which is we can use for the hypertension, but at the same time they can protect the kidney from the diabetic nephropathy. So such type of drug, we have advised physician to use more, to prevent the chronic kidney disease.
Okay. So, Dr. Wanda, can you talk about, you mentioned a bit about this already in your conversation, but can you please elaborate on whether people who have hypertension are more prone to diabetes, and is the case vice versa, like people with diabetes are more vulnerable to develop hypertension? Is that the case?
Absolutely, you're very right, actually. In fact, this is one of the key messages that we
Mhm.
wanted to give in the guidelines, that people who have high blood pressure check their blood sugar levels regularly, and those who are diabetics control their blood pressures more effectively. In fact, it is known that good blood pressure control in diabetic people can prevent, as Jyotirmay Paul was just now saying, kidney, because kidney is one of the end organ which gets affected, kidney, brain, and heart. And if you are able to control the blood pressure of diabetic people more effectively, that will actually make the occurrence of end organ damage effects much less. So you will be prolonging the longevity of life of the people. And the problem with both these diseases is they don't cause much symptoms. Hypertension, in fact, hardly causes any symptoms. Only people get headaches and some vertigo. Diabetes, of course, causes delayed wound healing. People have to get up in the night to pass urine.
Mhm.
They what we call as polydipsia, polyphagia. Their appetite increases and they want to drink more water. But unless you get your blood sugar, every normal, healthy individual beyond 30 years of age should get a blood sugar checked and blood pressure checked once every year. Because when it starts in an individual, it's very difficult. And at times in our country, we have seen people come to actually the doctors by the time some end organ effects have already occurred. If we are able to pick up these diseases early, the doctors can manage the blood pressure and sugar more effectively. And as you rightly said, when they are together, their vagaries are even multiplied, rather than it's not an addition of the effects. The
Mhm.
effect gets multiplied. So, good blood pressure control, good sugar control is not only dependent on lifestyle methods, but also on effective and drug compliance. Very often, actually, one of the biggest problems we face as doctors is patients become complacent. They feel now my blood pressure is controlled or now my blood sugar is controlled and I can stop this. There is no cure of actually hypertension and diabetes. People have to be told that the medications have to be taken lifelong. And as Dr. Jyotirmay said, we have many drugs now for diabetes, we have many drugs for high blood pressure. The physician to whom a patient goes will tailor the best medicine for that particular ailment, and it is upon the individual to be more compliant on a regular basis. Unless the drugs are taken regularly and blood sugar pressures are controlled, the effects cannot be prevented actually. So
Yeah.
patients have to participate in their treatment as effectively as doctors do.
Yeah. Apart from the medicines that you just talked about, the kind of medicines, there is a lot of emphasis also on measures like adjunct therapy, such as yoga, at home blood pressure monitoring. Dr. Jyotirmay, could you tell us, is there evidence now that in people with both hypertension and diabetes, these measures actually help improve the outcomes?
Yes, definitely. We have taken both the drug therapy and adjuvant therapy like yoga, daily regular exercise, walking, diet, everything, particularly the salt intake. If you take all these measures together, some people don't take lifestyle measure, only take medicine. You will not get the desired result. Some people think we will not take the medicine, we will take the on the lifestyle. You will also not get the measure. So
Right.
together, you have to take measure together. And if you take the measure together, your both blood pressure and blood sugar not only will be controlled, your every organ will be protected. That is the main issue nowadays of treating the hypertension diabetes. Hypertension treatment does not mean only numerical reduction of the blood pressure or numerical reduction of the blood sugar in case of diabetes. It is the organ protection. That is the main issue because people die of hypertension and diabetes due to the organ failure, either brain stroke or heart attack or kidney failure, like the organ failure. So protection of the organ is most important. That is why we have advocated such drugs that can protect the organ. So the catastrophic effect will be prevented. That will give the better longevity of the people. Also, another important point to remember, when a person suffers from such a non-communicable disease like diabetes or hypertension, if same patient suffers from some communicable disease, maybe some dengue, malaria, whatever may be, their outcome become worse. So to have a better outcome from a communicable disease, also this organ protection out of diabetes and hypertension also very important. So if you can protect the control the sugar and pressure and control the organ, you will be not be protected from the adverse effects of non-communicable disease, also from the communicable disease also. That is
Yeah,
the key message of our guideline.
guidelines. Yeah. Dr. Wanda, please tell us, in your experience, are you seeing more younger patients suffering from hypertension post-COVID? Has pandemic made any difference in the kind of, the burden of hypertension and also younger people getting it as compared to earlier?
Yeah, that's a very good point you made. In fact, Jyoti May Paul also just now said a very important aspect which we learned during COVID, that people who had uncontrolled diabetes, people who had uncontrolled blood pressure, they, with the onslaught of the infection of the virus, they succumbed more often than those who were non-diabetics or who had good blood sugar control. So what he's
Right.
trying to say in a way is one has to prepare the body in a way that your sugars are controlled, blood pressure is controlled, so that if some acute insult occurs at any time, your body handles that acute insult in a more effective manner. And none else, actually, COVID taught us this in a better way than anyone could think of. Coming to your question, actually, COVID uh, did result in thrombotic complications, whether they were strokes, whether they were heart attacks. Also, COVID resulted in actually sedentary lifestyle. People were made to remain at homes. They started using actually some of these indoor games more frequently. Lifestyles altered very significantly. Now people have to be told to go outdoor, to move out. Young children have to be encouraged to go to the playgrounds. Adults have to take a lifestyle in which they start exercising. Certainly, COVID has resulted in a changed lifestyle, which has not been good for people in terms of diabetes and hypertension prevalence. Younger people, yes, we are seeing many more actually with this fast food and the Western kind of trans fats that we are taking. See, any food that is preserved is high in salt and fat, because the best preservatives are salt and fat. So whatever we order from non home cooked food is something which is actually going to be very deleterious for Indians in the future, and somehow we have started adopted this in a very big way. So such lifestyle modifications, people need to be told that we are through the COVID pandemic. You are lucky, all of us who have survived that. Now we have to have a healthy lifestyle, more of outdoor exercise rather than exercise in the gyms, diet which is low in fats and salt, regular, as you pointed out and Jyotirmay emphasized. Now we have strong evidence that yoga and meditation, besides physical exercise, yoga meditation has a mind calming effect, and all these diseases actually can be reduced, their effects can be reduced by. So as Jyoti said, it is a holistic approach to the disease in which drugs, weight reduction, diet, exercise, everything has to be taken care of by the individual. And a physician has to actually, we have emphasized, participate and impart knowledge to the patients regarding all these aspects which will be beneficial for the patient.
Very important points there. So thank you so much. We are now wrapping up the discussion. Thank you so much, Dr. Jyotirmay and Dr. Wanda,
Thank
for
you.
joining
Thank
the
you. Thank you.
discussion. Yeah.
Thank you.
Thank you.
Thank you.
Yeah, to
Thank
our
you.
viewers, I have a request. If you have any questions or topic in mind on which you want me to talk about, please reach out to us. Thank you for watching. Have a
Thank you.
good
Thank
day.
you. Thank you. Thank you.